Today in Health Matters, we look at how physicians are using color to detect signs of certain cancers. Our lives are full of color. In our homes, office, on the roads, and gastroenterologists look to color when they're diagnosing Barrett's esophagus.
Barrett's esophagus is where the lining cells of the esophagus begin to change. And instead of looking like typical esophagus, they start to look more like stomach lining.
Barrett's esophagus is a precancerous condition that can eventually lead to esophageal cancer. There are no signs or symptoms, which is why Dr. Weiss looks at the color of the cells to make a proper diagnosis.
The pinker color or salmon color of the stomach that tissue actually sort of starts to ascend or rise in the esophagus, whereas the normal tissue of the esophagus is more of a whitish color, and normally we see that changeover of the tissue right as you enter the stomach.
Dr. Weiss will use a flexible tube called an endoscope with a light and a miniature camera to get a closer look. Tiny tissue is removed for further evaluation.
With biopsy, that tissue actually looks more like small intestine than esophagus or stomach, and that is how you get the diagnosis of Barrett's esophagus.
Barrett's esophagus is slow to develop and is often diagnosed in people aged 50 and older. Just like screening methods to detect cancer, physicians will recommend regular endoscopies for those people who have trouble with acid reflux and other related problems.
The good news is that there is a precancerous stage that can be diagnosed, and then those people can be more aggressively treated for their reflux and hopefully ward off and lower the risk for cancer of the esophagus.
This can be treated with simple medications and periodic evaluations. Extreme cases of Barrett's esophagus may require surgery. Reporting for Lee Memorial Health System, I'm John Bafar.